All right, we've got some participants joining us. Wonderful. And whilst we're waiting for other people to sign in and log in, I just wanted to welcome you here. Very warm welcome to this live workshop where we're going to be looking at the 3 pillars of exceptional cancer care. I'm Dr. Mhairi Morris, and with me here today is my physically present virtual assistant. She's my PhD student. Her name's MJ Brown, and she will be answering any questions that you have. Hi, Tony, in the Q&A. So if you hover over your screen, you should see at the bottom a little kind of speech bubble with 3 dots in it. That's a chat box. If you click on that and it opens up, make sure it's selected to all panelists and attendees. If you have any questions at all, just type them in the chat box, and if it's something that's just like quick and easy, like I missed a link or whatever, then MJ can post it into the chat box there. But if it's something a bit more about course related, then MJ's going to collect all the questions and we'll have them at the end in the Q&A session. So I think we have a full house this morning. I'm really excited. I think we're maybe waiting on one more person who I was expecting. But whilst we're waiting, I'd love you to introduce yourself in the comments below. So as I said, I'm Mhairi. Can you tell me where in the world you're calling in from and what you do? If you want to just pop your message in the chat box below. Okay, so as I said, my name is Mhairi Morris and I'm a lecturer here at Loughborough University, which is where we're recording this live workshop today. And I've been studying biochemistry for nearly 20 years. I've been working as a cancer researcher for about 15 now. And I'm a lecturer, I teach biochemistry, I teach a lot of cancer biology, and I specialise in exercise and cancer. That's my research interest. And I'll tell you a bit more about me as we go on. Now, I know that your time is really valuable and you can't get it back, your time's precious, so I'm going to do my best to keep this under the hour. And if you have any questions, then please do just pop them in the... Hi, we've got Tony calling in from Surrey, not that far down the road then, so we're all UK based this morning perhaps? I think we are all UK based this morning. So I'm going to switch over to my slides, so I'm going to share my page, and when you have me on there, like you'll see me in the corner like this, you don't need to see me, you can just minimize me, which is what I'm going to do. And then I'll maximize my slides and hopefully this, but if my face is getting in the way, just close it down and put it out of the way. Okay, I'd love to hear why you attended this morning. So what's the one thing that you want to take away from this workshop today? You know, you've shown up here for a reason, and I really do appreciate the fact that you've given up your time to be here today. What I'd love for you to do now is to think ahead to a year from now, or maybe New Year's Eve on 2019. Now, it sounds like it's ages away, 11 months away, but it'll come round pretty fast, I'm sure of it. But I want you to imagine that you're maybe at a New Year's Eve party, you're holding a glass of bubbly in your hands and you're having a conversation maybe with your significant other or a family member or a friend. And I want you to imagine that you're talking back to yourself now. What would you like to be saying in this moment in time? What would you like to be saying in New Year's Eve to your friends and your family about all the things that you've achieved in this last year, all the lives, the many, many lives, the patients you've worked with that you've changed in this year? And then if you could tell me one word in the chat, although I can't access the chat, so I'm going to rely on MJ to tell me this. Oh, we've got the chat box open. Can I do that? So if I click on, sorry, as you can tell, I am not very savvy with the chat box. Can I show it? I can show it. No, I can't show it. Ah, boo. Never mind. I'll just have to sit next to MJ to see this. So we've got MJ, we've got Lucy from Essex. We've got lots of people from the south this morning today then. You had breast cancer 3 years ago and now you want to reduce and empower people on the journey to get through as easy as possible. I feel like, I'm sorry, and live life to the full with my support and education and understanding. I love that. I absolutely love that. That's exactly where I'm coming from. Okay, I've not had breast cancer, but I just want patients to have a better experience. In all the research that I've been doing through building this business, I've come across some quite horror stories actually, and I really wanted to make a difference. So is that another one, or is that okay? Good, right. Let's make a start, shall we? says. My slides are not working now. There we go. So in this workshop, I'm going to show you how you can step up your game as a cancer health professional. And by the end of our time together, I'd like you to feel that you've gone away and you've learned what I believe are the 3 pillars of exceptional cancer care, and some simple strategies that you can use to maximize patient engagement, and how you can begin to implement these strategies straight away. Now, if you stay with me until the end, I've got an exclusive bonus. It's available only on the webinar, on the workshop today. And that is the daily practice that will keep you from the brink of burnout. Now, this is a daily practice that I've implemented myself, probably just over a year now that I've been doing this, and it has made a phenomenal difference to my life. I am much more focused, I'm much more productive, I achieve a lot more than I used to on a daily basis, and it's how I've managed to build a business at the same time as running a full-time job and not lose my sanity. So I want to share that with you at the end, if you stick around at the end. And I also have another exclusive bonus that's also available, likely only going to be this week and next week, because I have only 10 spots available for this. But if you just stick around till the end, I'll tell you a bit more about what that entails later on. So for now, I'd love to ask you to be fully present, switch off all your other distractions. If you're anything like me and you have 20 pages open in your tabs open in your browser, just shut them all down, because otherwise it can slow your computer down, and turn your phone on to silent or vibrate. And yeah, let's get started, shall we? So there might be, I think, up to 4 reasons why you might be here, and there might be others, as Lucy's already shared with us. And maybe you're here because you're feeling frustrated because you have this desire to make a bigger impact with your patients. Or maybe you're here because you feel compelled to help your patients, as Lucy said, to enjoy life to the full, despite what they're going through. Or maybe you're tired of repeating yourself over and over and over again. Does that sound familiar? Or no, is that just me perhaps? I'm repeating myself with my students, don't I? And then maybe you feel lost in the complexity of cancer as a whole. But whatever your reason for being here, whatever your motivation, I want you to know that I fully support you. So this is me. It was about 10 years ago now. I graduated from the University of Birmingham with a PhD in tumour virology, or viral oncology, or basically a viruses or specific virus that causes cancer. And the hat that they gave me on graduation day was huge, and it kept falling down over my eyes. My husband took this photograph and he likes to share it everywhere. That was been working, like I said, I've been studying, biochemistry for nearly 2 decades. It'll be 19 years this year. I've been working in cancer research for 15 of those. I have been teaching in higher education for nearly 6 years now, and I've won awards for my teaching. So I'm a senior fellow of the Higher Education Academy, which is a UK organisation that recognises and rewards teaching excellence. And I also, when I was working at my previous institution, was given the local teacher fellow status on account of the teaching that I did in cancer biology with my students there. So I love teaching. It's what I love to do. Also a very proud mama to Isabella. She's 8 years old and got the heart as big as a bucket. I'm married to Andy. This was us on my birthday a couple of years ago in Glasgow. There's a lovely restaurant there called Windows Over Glasgow, and there's a roof terrace. And we didn't ask for it. We just happened to tell the waitress that it was our anniversary. It was my birthday, anniversary when we got engaged, and this is where we got engaged. And they brought out champagne for us. It was lovely. And I've also, as I said, I do research, and my research interests are around cancer and exercise. And specifically, I'm trying to generate in vitro models. So this is models, cell-based models that we can use in the lab to investigate the effects that exercise might have on reducing cancer spread and growth. Now, I have 3 students currently, MJ, who's here in the chat, and Jin, who's just started in October, and they're both here at Loughborough. And then this student here, this is Alexandra, who is still working at De Montfort University. So she is working on a slightly different field. She works on the virus-associated cancers that I used to work on, but she herself is a force to be reckoned with. This photo was taken in September 2017 when her little girl was 3 weeks old, and she'd made it to the final 6 of the national competition for this 3-minute thesis. So you have 1 slide and 3 minutes to explain your research in everyday terms, and she got down to the final 6 despite having just had a baby. Honestly, she's incredible. But I really love working with students and teaching and educating and just driving that passion in others. I love seeing that light bulb moment when somebody else really gets it and says, oh yeah, I want to do that, I want to make a difference. But the science, as you know, is complex, and I used to struggle myself with reading scientific papers. Certainly, it's like learning a different language altogether. Some of the words you can't even pronounce unless you have to practice pronouncing them. And I have to certainly still find this with certain drug names. I find it very difficult to pronounce them. But then something clicked in me, and suddenly it became one of my better skills, explaining complex science to other people. And I'll tell you a bit more about that towards the end. And it was around about this time, so I started to develop my teaching skills, and I started to take on a module where I was teaching all about cancer to undergraduate students. And it was around about this time that I had a really, truly humbling experience where I had the privilege and honour of meeting with a group of teenage and young adult cancer patients at the Teenage Cancer Trust unit up at the QMC hospital in Nottingham. And they were incredible, such positive mindsets, and really frank and candid and honest about their experiences. It was something I'll never forget. And it was about this time that I felt that tug to do something more. I'd always felt frustrated by the fact that any research breakthroughs I made would not really make any difference to a patient for years to come, because that whole bench to bedside process can take 15 to 20 years, and not to mention millions of dollars as well. So I felt like I wanted to do something more, and not just wearing a pink ribbon or going running 5Ks and raising sponsorship for charities. And it was around about this time that I had the idea for essential cancer education. So my whole ethos with the business is about communicating the complex simply, but also raising awareness about the things that we can do to prevent cancer in the first place, and to prevent secondary metastases as well. So at the beginning, you remember I asked you to think ahead to a year from now, and I asked you to think about what you would love to hear yourself saying to your friends and your family about your achievements, and how many lives you could change in that time, and truly change in that time. How many lives would you like to change? Can you imagine if you could walk in the door every night after work and close that door with a real sense of peace, that you know that you've made a huge impact in this world in this last day, this last week, previous months, maybe even this whole year? And that is what we're here to talk about today. It's about how we can level up our practice and make a bigger impact in this world with the patients that we work with. So becoming that exceptional cancer health professional that you know you were made to be will mean that you'll be no longer frustrated by the feeling that you want to give more but make a bigger impact, but you're not quite sure. You maybe feel a bit stuck, you're not quite sure where to start. And instead, you're going to feel more confident and more empowered, and feel like you're fulfilling your life's purpose to change the world and change the lives of the patients that you're working with, and do that with clarity and intention. So let's start with our 3 pillars, as I see it, of exceptional cancer care. The first pillar is this, that exceptional cancer care starts with the patient and it ends with hope. So to start with the patient, they really need to be engaged and interested in listening to what you have to say, but sometimes all that emotional response, all the extra emotions that they're going through at that time, can make it hard for them to really engage in that process, and can be difficult to hear and understand what they're being asked to do, because they're still internally processing, oh my goodness, I have got cancer, and it's a huge deal. So how do we actually engage them in proactively to make the positive changes that they can make to live more healthfully? So I recently had a conversation with a lady in the States, and she was diagnosed with cancer a few years ago, and mercifully has been cancer-free now for many years. But she recommended this book to me. It's called Dancing in Limbo, and I've got it here. It's very old, and you can see it's very well thumbed. I've got lots of tabs in it. It's a quite old book. It was published in the mid-90s, and it was written by 2 cancer survivors themselves who were talking about their experience post-treatment. So when they've finished all the treatment, this is where often patients feel that they're just kind of cut adrift, and while they're going through treatment, they've got all manner of support, but once they've finished, that's when they feel like they're in this limbo period. Now, we call that survivorship, but this is what the authors call limbo. And they sum it up beautifully when they say, when we wake up in limbo, we are alone, acutely aware of our vulnerability and helplessness, and filled with the dread of recurrence. And it's this word dread that really strikes me here, because when we have dread, we can't have hope, or at least it makes it more difficult to have hope. So how can we take someone past that feeling of dread and fear of recurrence and look forward with a sense of hope? Well, one answer could be to set, or to help them set, health-related goals, and then to map out an action plan to achieve these goals. But I believe it's more than just about goal setting. I believe it's also about understanding the psychology. And understanding, sorry, the subconscious biases that we all have as human beings. So, for example, in the field of psychology, there's a theory called loss aversion theory. And basically, the premise of this is that we feel more heavily, we're more inclined to avoid a loss than we are to pursue a gain. And so I wanted to use a very simple example to explain this. So let's say you'd gone to the cash machine and you'd drawn out £100 or $100, and then you decided, you got distracted, like maybe your phone rang and you walked away without actually waiting to collect your cash. Now, this has actually happened to my sister. It wasn't 100 quid, I think it was only about 20 quid, but she was still really annoyed at herself for having done this. But I wanted to ask you, how would you feel if you imagine yourself in that situation? How would you feel about that? You'd be really upset with yourself. Now imagine that you've bought a lottery ticket and instead you've won £100 or $100. How would you feel now compared to that? Well, according to loss aversion theory, the research behind it says that we humans will feel the weight of a loss more heavily than we will the equivalent gain. And this theory actually works quite well when we're promoting certain health behaviours as well. So for example, if you compare these two phrases, so check your boobs, you'll be more likely to find a tumour in the early, more treatable stage of disease. This is an example of positive framing. And you compare it to this one, if you don't check your boobs, you'll be less likely to find a tumour in the early, more treatable stage of disease. This is framed as a loss. Now, the two phrases are very, very similar. I mean, blink and you'll miss it. But research shows that actually this latter phrase that was framed as a loss was more effective in encouraging people to undertake breast self-examination. And for the record, I don't think they used the phrase check your boobs. I'm just paraphrasing here. But in essence, if you frame it as a loss, it's more likely to be taken up by your patients. So here's one strategy that I would like you to try today that you can implement straight away. So I want you to imagine a scenario. Maybe you've got a patient who you're trying to encourage to undertake a certain lifestyle change. Maybe you can think of a few examples that pop to mind already. And then after the workshop is finished, I'd like you to write down word for word exactly what you would like to say to them as if it was framed positively, frame it positively. And then also I want you to write it out as if it was framed as a loss. And then what I'd like you to do is practice this loss aversion framed version. That's a mouthful. Practice that out loud 10 times, and that way the habit is ingrained, it's already in your brain, so that when you do come to have the conversation, it comes out more naturally. It's what comes to the fore. So now that we've talked about exceptional cancer care that starts with a patient, let's turn our attention to how we can bring them hope as well. So in her best-selling book, Time to Think, which I've got here, by Nancy Klein, she describes 10 key elements of a quality thinking environment. And I've written about this previously, and I meant to send you a link to put in the chat, but if you just want to pop in the chat box, it's www.essentialcancereducation.com /blog/listening. Thank you. So you can follow the link to that blog post there if you want to read more about it. I've already written about her 10 key elements of a quality thinking environment. And in the blog, I focused on 6, but today I just want to focus on 3, and I've called them the 3 A's of a quality thinking environment. And the first is asking incisive questions, then showing your patient rapt attention, and then having a place, whether it's your clinic or your office or wherever you meet your patients, that says you matter to them. So asking incisive questions. Incisive questions are the ones that start something along the lines of, if you knew that, or if you were to, and then they encourage the thinker to really open up their minds to the possibilities of what might be. So for example, you might ask your patient or your client, if you knew that you couldn't have done anything differently to avoid getting cancer, how would you approach living your life now? And the reason I ask this, and the reason I set this question, is because through all the research I've done, I've found there's quite a disproportionate amount of patients who seem to believe that they've done something to cause their cancer, or maybe they've not done something. And yes, some cancers are caused by what we can change, but not all of them are. And I don't think, even if it is something that we've done, like, I don't know, we're smokers or whatever, it's not helpful, I don't think, to the patient to carry around that guilt around wishing they'd done something differently. I think what's more helpful is to get them to think about, well, if you knew that you couldn't have changed anything, because you really can't now, how will you live your life differently now? It's all about facing them forwards and planning for the future to live a life full of hope. So giving your patient attention and undivided attention, obviously, it might sound obvious, but you'd be surprised how often I hear exactly the opposite happening. And now listening with respect and showing genuine interest, even fascination with what they've got to say, can help build this safe space for them where they feel able to open up and pour out all their thoughts and their feelings about what they're going through right then. And then this place in which you cultivate the generous thinking environment can also boost a patient's sense of hope, and if it communicates back to them that they matter. So what I'd like you to do now is just think about where you meet your patients, and is there anything that you could change or would change that would make it more of an environment that says to your patients, you matter. So by developing all these key skills, this art of listening, and really truly hearing what your patients have to say, this can really give them the best gift that you can give them, which is time to think. And then with that gift, this can help bring forth hope and, of course, clarity, and is more likely to encourage them to take action as well. Now, the words that we use are important, but more important is also the way in which we frame them and emphasize them, as we've already mentioned of framing, but let's talk about emphasis. So consider this first quote from a patient. His name was John, and he's talking about his Macmillan cancer nurse. Now, I think we're all UK based, so you all know who Macmillan are. Usually I explain who they are, but I think you're all familiar with them. And he said, they cared. You didn't feel like you were talking to a robot. You didn't feel if you told them something, it was going to be ignored. They genuinely cared. Now, we don't know who this nurse is, but kudos to him or her, because they really did a great job of creating this generous thinking environment for John. But now contrast this with this phrase here that is from an anonymous breast cancer patient who, when she went for her first mammogram and the nurse said to her afterwards, we will see you here again next week, she said she was totally deflated. She knew, she had a hunch that she'd got cancer, that something was wrong, and she expected to have to go back the next week. But she said the way in which it was phrased, we will see you, was just not helpful at all. It left her feeling really devalued and really quite depressed about the week ahead. So all this to say that patients really pick up on the nuances. So it's very important to, even no matter how bad the day we've had, to try and keep our tone of voice as neutral as possible, especially when we're delivering like bad news, but also news that we don't know the outcome of as well. And I think this phrase from a study that was done in 2013 really sums up this first pillar of exceptional cancer care beautifully. And they say that patients' primary desire was a psychosocial environment where they were seen as a unique person, and the patient wanted opportunities for good encounters with staff, fellow patients, and family members, and to be supported by a good physical environment. And the patients also valued highly a place to withdraw and to rest as well. So let's move on to pillar number 2, which is equipping yourself as a health professional so that you have all the required knowledge and understanding to be able to help your patients make informed decisions about their care options. When I first started lecturing, excuse me, when I first started lecturing, my boss said to me, never forget how green you once were. And this acronym here stands for Keep It Simple, Stupid, which, great advice, best advice I ever had, hurts my feelings every time. It's a quote from the American Office, but it's become my mantra. And of course, what my boss meant by that was, don't forget how when you first started out, you've got no background and knowledge. And so you're building from very simple building blocks, and then you go from there. And it's very easy to forget that when you're so many years down the line. that what you know is not what somebody 10 years before you are completely new to the field knows. And I think this also is really important for when we're talking to patients, keeping it as simple as possible. And of course, science isn't simple, is it? Otherwise, we'd have cured cancer by now, wouldn't we? But it's important to use really simple language and to use things like everyday metaphors and analogies that can really help make it more relatable to patients and students as well. So, for example, I was giving a lecture a few weeks ago on exercise and cancer, and there's a particular immune cell type called the natural killer cells that are mobilized by exercise. And it was a completely, these students hadn't really covered much immunology at that point, and I didn't know how much they knew about natural killer cells. So I had a picture of a Dalek up because I think certainly in the UK, but most of the world, we know who Doctor Who is. We know what Daleks do. We know that they're there to exterminate. And so they were able to then, even if they don't understand the full science and the molecular biology behind how these cells kill cancer cells, if they can just relate it with, oh, a Dalek exterminate, that's what they exist to do, then it makes it much more memorable for them as well. And then I said earlier on about my light bulb moment when it really clicked to me how to teach the complex science in an easy to understand way. And this might not actually be that surprising to you, you're probably familiar with this, but when you really understand something, you're much more likely to remember it rather than if you just kind of parrot fashion try and shove it in your brain. But also to really understand, this is where the light bulb moment was, to really understand it, it helps to teach somebody else. And then years later, I did my postgraduate certificate in higher education and discovered this is actually a thing. So students will remember maybe 5% of the lecture, the 1 hour lecture that we deliver. Whereas if they teach it to their peers, they're much more likely to remember up to 95%. And certainly as a person who's been a student and not remembered much and been a lecturer, it's amazing how much more sinks in when you're teaching other people. So another simple strategy you can use now is if you've got something that you're trying to understand and you want to be able to practice talking to your patients about it, then practice to yourself in the mirror. I'm not kidding. I used to sit at my desk in my study at my home when I was at university, and I would look at my reflection in the window and talk to myself as if I was talking to one of my friends and explaining the process of, say, I don't know, DNA transcription or something. And that is how I got through my exams. That's how I remembered things. So definitely teaching is a great way to learn. And clarity and simplicity really do go hand in hand, but don't oversimplify. It's important not to be patronizing, but also don't overcomplicate. It certainly is a fine balance for sure. So when you're giving the patient any key information, what I think is really helpful is to imagine them as a still body of water, a bit like this lake here. And then imagine that each piece of information that you're giving them is a little stone that you drop in. And you wait for the ripples to expand and then disappear before you drop in the next one. And what I mean by this is simply don't overwhelm them by dumping all the information on them at once. Just kind of drip feed what is necessary at that time, but also being self-aware enough to know that you're not patronizing them at all. And as one patient recalled, you're given so much information at the start, it's overwhelming. And I'd also like to iterate here that this goes for patients who are also very, very familiar with the science. So I have a friend of mine who has been diagnosed with breast cancer, and I can't remember if it's Oxford or Cambridge, so we'll say Oxbridge. She graduated from Oxbridge with a sort of biochemistry background. So she knows the science, but yet she still said it was really overwhelming because it's the emotions that you're going through at the time. You just can't think clearly. And then, of course, when you're going through treatment, the effects of chemo brain, it's not like I want to use the word normal, but you know what I mean. It's not like when before you had that, and you can process things normally and quickly. When you're going through the emotional upheaval that a cancer diagnosis comes with, and of course the effects of chemotherapy, it makes it even harder for them to digest. And then, of course, there's the bewildering array of options available to them for their treatments. And we're living in the day and age where we've got patients who are drawn in by finding answers from Dr. Google, especially if they want to pursue some complementary alternative therapies. And it can be hard to know how to advise them if we don't understand ourselves, what all the different options are and what the evidence base is behind it. So it's extremely important that we equip ourselves with that evidence base and all the information that we need so that we can have helpful and constructive conversations with them rather than fearful or dismissive conversations. It's also crucial that the patient feels they have some degree of choice in the matter as well, that they can pursue the right course of action for them, and that when they choose something that may well have been debunked by the scientific community, that we don't meet it with judgment, we treat them without judgment. And then I think, so there's a guy called Michael Lerner who runs a retreat center in San Francisco called Commonwealth, and as he says, it's the lived experience that matters. So if a patient is pursuing a complementary therapy, and there isn't really any scientific basis for it, but if it's not doing them any harm and it's not holding them back from undertaking their other therapies, then I don't think, if they're feeling that they're benefiting from it, I don't think it's our place to tell them that they can't pursue it anymore. That's just my opinion though. Okay, so let's move on to pillar number 3, which is about empowering our patients for shared decision making. So in order to make the informed decisions, our patients really need to have all the facts in front of them, both sides of the argument. And I recently wrote a piece on what not to say to a patient, and the link is here again. MJ, I think, is going to pop it into the chat box, so you can just click it and follow it if you want to, or copy and paste it into your browser. But when I was doing the research for this post that I wrote, one of the phrases that kept coming up was something along the lines of, if you don't take this drug, then you will die. Talk about doom mongering. I mean, it might be true, or it might have some truth to it, but it's not particularly helpful for the patients to be told, to have that fear conjured up inside of them that you're going to die if you don't do this. And I think it's also important that when we're talking about different therapies and the risk reduction, that they're aware of the relative risk reduction, not just being bamboozled or swamped with different numbers and statistics being thrown around. But in order to encourage our patients to make lasting behaviour changes, then it really needs to be enjoyable, first of all, and also sustainable. So for example, if one of your recommendations is to get them to move more and get more exercise, then they absolutely hate running. It's hardly any point in telling them to go and join parkrun. Equally, if they're a single mother with 3 young children, telling them to go and join the gym 3 evenings a week isn't going to be very sustainable for them, unless of course they've got lots of family nearby who can help them out with babysitting. And I mentioned earlier that not every cancer is caused by something that we do, but nearly half, it's about 42-43% of all cancers can be prevented just by making better dietary and lifestyle choices. And I think it's really important that we understand some of these causal factors and the environmental stressors that can contribute to the disease. Now, some of them might be quite obvious to you, such as smoking and lung cancer, or sun damage and skin cancer, but others might be not so obvious. So for example, certain viruses are known to cause cancer in patients who are taking immunosuppressive drugs. Maybe they've had an organ or a tissue transplant and they have to have immunosuppressive drugs to stop their bodies from rejecting the organ. This is when the tumour viruses have an opportunity to cause a tumour to grow out. And one of the biggest causes these days of cancer is obesity. And this is because really our fat cells secrete estrogen, and estrogen itself is a growth hormone, and that causes our breast cells to grow, both healthy and cancerous breast cells to grow. And normally it is counteracted by the action of progesterone. So progesterone acts a bit like the brakes on the cell growth, and it does so by switching down or switching off or shutting down the number of receptors on the surface of the cells that bind to estrogen. But when a patient with obesity who's got lots of more fat cells and is producing lots more estrogen, there's just too much in the system to be dialed down by the progesterone. There's not enough progesterone to negate the effects. And it would be a bit like trying to drive a Ferrari fitted with the brakes of a Fiat 500. Not particularly good suggestion, and a disaster waiting to happen, really. But I believe that finding an individualised way to empower our patients is the way to make positive and lasting lifestyle changes. And it requires a clear vision and a structured approach. And there are a number of different frameworks already out there, but in my opinion, I think the best ones are the ones that are individualized to the patients and to their particular set of circumstances, and takes into account all of their holistic needs as well. So can you see how having an understanding of the emotions and the emotional impact of a diagnosis and a thorough grounding in the subject can, including all the evidence base for the different treatment options, can help you to feel more confident and to help you guide your patients in making informed decisions about their care. And I'd like to ask you, I asked you at the beginning why you're here, and you're here for a reason, and you've shown up live today, and I'm thrilled that you're all here live. And that shows me that you care, that you're a giver, not a taker, and that you want to make a difference in patients' lives. But I'd like to ask you if you'd like to step up into the exceptional and leave behind all the ordinary and everyday and make that bigger impact that you know that you're capable of doing. Perhaps you're here because you believe in your heart of hearts that you can truly impact patients' lives. Or maybe it's because you're passionate about helping patients to enjoy the time that they have left and to live that life to the full. Or maybe you feel it's because you've got limited time with your patients, and you know if you could just eke out a little bit more from those appointments, you could make a bigger difference in the world. Or maybe you're feeling overwhelmed and confused with all the literature and the many, many rapid advances in the field, and you just wish that somebody would do the research for you and make it all simple so that you know that what you have learned is based in grounded in solid science. So at this juncture, I believe that there's two options here. And the first is that you carry on as before and we part ways, and I wish you from the bottom of my heart, with all sincerity, the best. And I do hope that you will stay in contact, that you'll become part of the community, and that we'll continue to chat to each other over social media and whatnot going forward. Or you can take all this newfound knowledge that you have and commit 100% to leveling up your practice and join me in building your own professional framework for maximizing patient engagement. So if you're ready, if you feel you're ready to become this best version of your professional self, then I'd love to invite you to join us inside of Clarity on Cancer. And it's the only program, Clarity on Cancer is the only program of its kind where we help you to understand the biology of the cancer and also all the bewildering array of treatment options and the evidence base behind them, both conventional and complementary and alternative therapies, and shows you how you can use the understanding of psychology to maximize patient engagement so that you can spend more time helping your patients to achieve their top priority goals. So it's a 3-step program, and there are 6 core modules. In step 1, engage, you will learn to communicate more clearly and provide insights to help your patients cope. You'll discover your own individual coaching style and learn how to use this to effectively coach your patients, understand the emotional impact and all the psychological underpinnings of a diagnosis, and devise various strategies that you can use to help your patients cope. In the second step, we'll be equipping you with all the information and the knowledge that you need to communicate just the necessary elements to your patients and support them. Use this to support them in making the decisions they have to make and through this shared decision-making process. You'll have a deeper understanding, a solid grounding in the understanding of cancer biology, and be able to learn about all the different treatment options, both complementary and conventional. And using this, you can put it all together to devise an optimal care plan with your patients, not for your patients, but with your patients. And then the third and final step, empower, it's about empowering our patients. So you will have the confidence to empower your patients to make these positive, lasting lifestyle changes and be aware of all the different causes of cancer so that you can begin to build a picture for them of how they can reduce the risk of cancer and also risk of getting any secondary cancers recurring. And then finally, bring all this knowledge together to build your own professional framework to support your success in coaching your patients through their darkest of days. So there's 6 core modules. Module 1, effective coaching, where you'll discover what kind of coach you are and how to coach your patients and clients more effectively. Module 2, engaging with empathy, where you'll develop this deeper understanding of the emotional impacts and you'll get some tools and insights that you can use to help them cope. In the third module, explaining cancer clearly, you'll get a thorough grounding in the principles of cancer biology and build that solid foundation for your ongoing continuous and professional development. And then in module 4, equipping for treatment, you'll discover the wide range of the different treatment options that are available, and you'll be able to use this to help build that optimal care plan for your patients, with your patients. In the 5th module, empowering for change, you'll discover all the vast array of different factors that can cause cancer and increase a patient's risk of secondary disease, so that you can begin to build a picture for them of ways that they can help reduce their risk and prevent secondary recurrence. And then finally, in module 6, where we're envisioning your own professional framework, you'll pull all that knowledge together and build your own framework that you can then reuse and adapt time and again for all your different patients going forward. Now, this altogether, I've put a total value of $2,997. And this is based on the cost of an equivalent in-person training course. But this course is online, so we're not going to charge that, don't worry. In addition to this, you don't just get the 6 core modules, you get that plus all the downloadable audio that you can use to learn on the go. And you'll also get some bonuses as well. So the first bonus is an entire module where we'll look at the biology of the hallmarks of cancer that are common to all cancers. And this gets released at the end of week 4. Now, it coincides nicely with finishing step 2, equip. So you've just learned about the biology of cancer and you've just looked at all the different treatment options, and then you can go a bit deeper with biology and look at the hallmarks of cancer and how that complements it. And I'm nothing special. I think I want the same thing as you do, and that's to help those who've got cancer and are living with it to find healing, even if that healing is not a cure, because healing can mean many different things. But you'd also get other bonuses as well. So in addition to the hallmarks of cancer, you're going to get access to a private, exclusive members-only Facebook community with, I've said 8 weeks of accountability, it should be 6. I'll make it 8, it's fine. Now I do have a Facebook group open at the moment that some of you are in already, and that's fine. You're welcome to stay in there too. But this is just for students of the course of the programme, because then you can have much more private conversations and share with one another. So you're not just, you'll have me on hand daily in the Facebook group answering any questions that you've got as you go through the programme, but you'll also have each other to call upon for support as well. So you get the hallmarks of cancer bonus module and access to a private members only Facebook group where I said I'll be on hand daily, but you also get weekly live Q&A sessions with me for troubleshooting and clarity. Now this could be it will likely be in the Facebook group using Facebook Live, but if it's a problem, we can also use it through this online meeting system using something like this system here, Zoom. But basically what I would love for you to do is, as you're going through the program, make notes of the questions that you have. If there's anything that you're struggling with, if it's not quite clicking for you, bring it to the live Q&A sessions and we can troubleshoot together and work through it together there. So that altogether has a total value of $4,000 to $4,291. Now I've based this on, like I said, the equivalent of an in-person course and my charge out rate for my time at the university. But I don't want to charge that because I want this course to be affordable for you. I really don't want it put people off. So I'm charging less than a quarter of that, and probably a lot less than I likely should, only $997. Now, I promised at the beginning, if you stuck with me to the end, that we would have more details of a very special bonus that I've put together just for people who purchased today live on the webinar, well, during the live webinar. And that is this daily practice that I've been implementing for the last year or so that will keep you, and literally has kept me from the brink of burnout. So this is not just your 3-page PDF download with a guided meditation or anything like that. This is where I talk about all the different things that I've tried out, and there's been a lot of things, haven't there, MJ, where I try out different techniques to have a routine, a daily practice that I use, and it has made me immensely more focused at work, much more productive. It's made me calmer, more clear, generally less stressed, and generally happier actually as well. So if you want to get your hands on this bonus, all you need to do is enroll whilst we're still live here on the webinar. maybe you're thinking, oh, but I don't have time, and how much time am I going to have to invest in this? Well, I would like to challenge you on that one, because we all have the same 24 hours in a day. We all have the same amount of time each day, but we can all eke out vastly different levels of productivity. Now, my husband's a bit of a super fan of SAS, Who Dares Wins. I don't know if any of you watch it. Actually, on Sunday night, it was the last episode for this season, and there was an orthopedic surgeon on there from Glasgow, yay, and she was saying that one of the hardest things about her job is when she has to say to a patient, "You've got cancer." And she said, I watch these patients and they're so resilient, and they just take everything. They get so much thrown at them. And I think if they can cope with that, then I can do this. And this is like a really grueling SAS selection process. So hats off to her, but also hats off to all the many people who have to deal with the harrowing experience that it is of going through cancer. Anyway, my whole point of telling you that story is because of SAS Who Dares Wins. There's so my husband's a super fan. He loves Aunt Middleton and his blue eyes. And he got his book for Christmas, and he said there's this phrase in it where he said, "Are you too busy chopping wood to sharpen your axe?" We all, as I said, have the same 24 hours in a day. And we can keep ourselves busy with busyness. But if we don't take that time to stop chopping wood, to stop being busy, to sharpen our axe, then we're not going to improve. And your knowledge and your skills and your coaching abilities, this is how you keep yourself sharp. So I just challenge you not to think, I don't have time, but just to think, well, how can I use my time effectively? Or maybe you're thinking, well, how do I know if this is for me? Well, it is basically for anyone who works with people who are living with and beyond cancer. So what I would say is it's not a course for patients, and I can signpost you to some excellent patient resources if you're interested in that. But it is a course exclusively designed for professionals who are working in the health, wellness, and coaching industries, including but not limited to, and I'm reading off my notes here to make sure I get it right, allied health and wellness professionals, health, wellness and life coaches, integrative and functional medicine practitioners wishing to specialize in cancer, occupational therapists, nutritional therapists, psychotherapists, counsellors, oncology nurses, physiotherapists, and survivorship team members. Like I said, the list is not exhaustive. If you are working directly with patients who are experiencing cancer, then this program is ideal for you. Maybe you're thinking, but I'm nothing special, I'm just me. Oh, but I'd like to challenge you that you are. The fact that you're here says to me that you are special. You care, you have a big heart, you're a giver. And I love this phrase, to make something special, you just have to believe it's special. And I can tell you that I myself have experienced this mind shift in this last year. I used to think the same, I'm nothing special, what am I? And I still think I'm nothing special, but I know I have skills and I know I have abilities and I can make a change, make a difference in this world, and so can you. And I'd love to help you to do that. So we're going to move into our Q&A now, and if you have any questions, what I'd love you to do is pop them in the chat box, and then I'm going to ask MJ to show me them because I can't see them on my screen here. So we often get a few questions. Can I just have the questions list over here? Thank you very much. So often I'm asked about how this particular program differs from my other program that I have available. It's called Cancer Essentials, which is very much an introductory starter for 10. So the answer to that question is it varies. It differs vastly. It's very, very different. So the Cancer Essentials program is very much an introductory course that just talks about the biology of cancer and a little bit about the hallmarks, whereas the Clarity on Cancer program is much more comprehensive and covers all the aspects. We've got the aspects of patient care, we've got the aspects of patient psychology, we've got the aspects of you as a coach in coaching the patients through this time, and we've got all the science as well behind it, all the treatment options, and then there's the framework. Which brings me on to another question, if we had a question, no. Which brings me on to another question that I often get asked, and that's about the framework. What does that look like? Well, it's hard to describe without you seeing it, but essentially as you work through the program, you will build all this information together, and you'll be given a template that you can then adapt, and you can, so for some of you, some aspects of it, you might be thinking it's not really particularly relevant for the work that I do with my patients, so you can just cut that bit out. But equally, you have access to that template to reuse and redo time and time again, so you can always go back and take a previous version and reuse it for future patients where it might be relevant. So that is all the frequently asked questions that I get asked. Now is over to you, really. I would love to hear if you've got any questions now. What I'd encourage you to do is not to go away today without having your questions answered. So if you're on the fence, or if you've got anything that you think, not sure about this, what about that, please ask now, because now is your chance. Of course, you can still email me afterwards at that email address, and I'll get back to you as soon as I can. Yeah, I think that's basically all the questions that I have. So I'd love to hear from you now. How have you got on? What's your one big insight that you've taken away from today? I asked MJ this question yesterday, and she said, the big insight for me was the fact that you are capable of doing this. It's just about believing in yourself and stepping up into that role. And actually, when you start to believe, that brick wall with the picture on it that said, to make something special, you just have to believe it is special. When you start to believe that you are and that you can do these things, you naturally step into that role. You naturally become that better version of yourself. Any questions? No? Okay. Oh, got a question here coming in. Now I can't see this without my glasses. I'm going to have to put these on. We have, this is something I'm working on, but I'm a very strong character, so learning how to be softer and not so gung-ho will help, definitely. Although I'm probably the complete opposite, and I'm a little bit too soft. I went on my Facebook Live last night, and I don't know if you saw this, and I said, I wrote a post recently about facing terminal cancer with courage and grace, and actually writing the post came really easily to me because I'm very sensitive, very sensitively so, but it was the sharing it that I found really difficult because I didn't want to upset people. But yeah, I for years believed that being a soft character was not a good thing. I believed that it was holding me back, but actually I've since learned that that is what makes me me. And I'd say it's probably the same for you. You think that it's a problem being gung-ho and you need to be softer, maybe just in certain circumstances, but maybe just owning who you are and being the character that you are. There are people who respond to that. And so what is the phrase I heard once? You may be the juiciest peach in the world, but not everyone likes peaches. Love that. Any other insights? I'd love to hear from you. To be honest, though, it was my character that gave me the strength to get through it. Absolutely, it was. Absolutely. I don't think it's any accident that you are who you are. I'm a fatalist, can you tell? Love the quote about peaches. Yeah, that's from Brooke Castillo. If you've not come across Brooke Castillo, she's the Life Coach podcast. So it's Brooke with an E on the end, and Castillo is spelled Castillo, I think. But she talks about that phrase, and I have it. I trot it out quite frequently. Does anybody else have any insights or any questions any burning questions you want to ask? I'll tell you what, I could probably stop sharing my screen now and just pop in, and then I could see the things. The Q&A. Oh, I did that, but then the timer stops. I shouldn't have done that. Never mind. I'll be generous with that time. We had roughly 8 minutes left, so it takes 8 minutes past. Where's my Q&A? There we go. How much is that in pounds? So $997 is about £726 currently. $97 is about £76-ish currently. I need to do the exchange rate today. I haven't looked at it today. Would you like me to do that now? Yes, I should. Let's have a little looky look, shall we? 997 USD to GBP. So $997 is £775.96 today. And then $97 if you want to pay per month. And bear in mind that the monthly payment will change each month as the exchange rate changes. So $97 is £75.49. That was a pretty good guess. I said 76, didn't I? Any other questions we've got? This is great. It's about 775 today. Thank you. I'm really glad you enjoyed it, and if you did, spread the word. And I love the fact that you've all shown up. Really, really encouraged. But please do share this with your friends and colleagues, anyone that you think might find it useful. And do keep in touch. Head on over, if you're not already in the Facebook group, head on over to Facebook and just search Essential Cancer Education. You should see the community there. You'll see my face. And then, yeah, let's keep in touch. Have a great rest of your day. I shall sign off now. And any questions, just drop me an email, barry@essentialcancereducation.com, or you can PM me, private message me on Facebook. Oh, another question. Why in dollars and not in pounds? Because I am making this course available across the world, essentially. And it also makes it easier for me when I'm doing my convert. So all the things that I pay for, so the the software that I house the course on, all of that I get charged in dollars. So it just makes it easier for me to work out. But yeah, a good question. I probably should do it in pounds, but then I don't know. I wanted to make it available to the whole world. So my students are typically in the UK, the US, Canada, and Australia. That's where I'm mostly focusing on at the moment. Although I've had a student who lives currently in the UK, but he's from Africa, and he said, can we get this? Can we get this over into Africa? And I was like, yes, but I'm not quite sure how that's going to work. But yeah, maybe one day. Thank you very much for your questions. All right, have a lovely day, and I'll see you all again soon. Bye for now.